Hello everyone. The topic which will be covered today is epidemiology of oral cancer. The cancer is defined by World Health Organization as uncontrolled growth and spread of cells, growth which often invades surrounding tissues and can metastasize to distant sites. It can be prevented by avoiding exposure to common risk factors such as tobacco, smoke, etc. And the significant proportion of cancers can be cured by surgery, radiotherapy, or chemotherapy. Oral cancer is the term used to describe any malignancy that arises from oral tissues, and in the International Classification of Diseases, oral cancer is classified under the rubrics 140. Epidemiology of oral cancer is an important public health issue, and during social engineering phase, that is in the year between 1960 to 1980, a pattern of disease changed in developed world. New health problems in the form of chronic diseases began to emerge, that is like example, cancer, diabetes, cardiovascular diseases, alcoholism, and drug addiction, etc. A new concept, the concept of risk factors as determinants of these diseases came into existence. Non-communicable diseases are a major threat to development, economic growth, and human health. Here's the picture showing a global scenario of oral cancer around the world, where it is the sixth most common cause of cancer-related death, and 1 to 10 cases per 1 lakh population is uh, coming up to be of the cancer. In terms is the most common site, where Denmark, France, and Germany is the Scotland is the Central and Eastern Europe part of the world is the most common affected countries. The spectrum of oral cancer India shows, this map shows that the highest incidence of oral cancer in the world is is in India, and 12% of the cancers is found in men, and 8% of the cancers are found in women. 500,000 cases of the cancer added every year, which is linked to tobacco habits. Here's a triangle which shows epidemiological triad of oral cancer, where it can be appreciated and seen clearly that until there's a presence of host environment and causative agents, the disease cannot occur. So for any disease to occur, all these three factors need to be present. Under the host factor comes gender, age, race, genetic characteristics, socioeconomic status, effects with those low socioeconomic status, education, occupation, and lifestyle. Under the agent comes the biological factors like human papillomavirus associated with cancer, chemical, that is habit of tobacco with lime, like example, opal gas strategy, exposure to methyl isomate, and third is the mechanical agents. Chemical habit of applying dry lime and katha on superficial mucosal lesions, abrasion for healing is a common practice in North Central India. And in 1984, Bhopal gas tragedy, the local population exposed to the high level of methyl isonate showed a marginally increased risk of cancer of oropharynx, suggesting it to be potential established risk habits. Mechanical factors include an association between oral carcinoma and chronic irritation of the mucosa by the dentures. Cases have been reported and have detailed the development of oral carcinomas in patients who wear ill-fitting dentures. Coming on to the environmental factors, UV radiations like solar radiation is carcinogenic, that which causes skin cancer and lower lip affected due to sunlight exposure. Now coming on to the etiology and risk factors for oral cancer, one is smoking tobacco, chewing betel quid, heavy consumption of alcohol, presence of potentially malignant oral lesions, and here are some other contributing or predisposing factors of oral cancer. Major risk factor for oral cancers are tobacco and alcohol, and a synergetic effect of tobacco and alcohol has been observed. Alcohol may promote carcinogenesis by including dehydrating effects of alcohol on the mucosa, increasing mucosal permeability, and effects of carcinogen in tobacco, nutritional deficiency, and solubilizing tobacco. Incidence and prevalence of oral cancer. The high incidence of oral cancer in India has long been linked with the habit of betel quid chewing, tobacco consumption, smoking, indigenous method of oral habits. The dietary deficiencies such as vitamin A, C, and E, and iron deficiency can also be one of the causes. Genetic deposition, sunlight, dental trauma, viral infection, air pollution, and environmental exposure. Chronic sepsis in the mouth or chemical agents are one of the leading factors. Diagnosis of oral cancer can be done by biopsy, exfoliative cytology, toluidine blue staining, uh, computed tomography scan, ultrasound, and magnetic resonance imaging. Treatment of oral cancer includes the prevention and control of cancer, health education, in which health education is given, secondary prevention, and the tertiary prevention. It can be divided into three. And primary prevention includes mainly which focuses on modifying habits, educational programs, warning signals, health education, and three well-known approaches like regulatory approach, service approach, and educational approach are being applied. Educational approach is mainly the role of a dentist, where the prevention and early detection of the cases are done, and is the health education is given by the dentist. Then the tobacco intervention has the guidelines shared by Tobacco Cessation Cell, which has 5 A's. One is ask, advise, assess, assist, and arrange. Pharmacotherapy includes nicotine replacement therapies, that is NRTs, nicotine gum, nicotine patch, nicotine inhalers, nasal spray, nicotine lozenges, and antidepressants are also sometimes included. Secondary prevention includes the screening, early detection, and referral. And the tertiary prevention includes the once the disease has gone into the advanced stage, where surgery, radiotherapy, and chemotherapy are to be included. So we would conclude the lecture that dentists and other health personnel have a responsibility to assist patients in minimizing risk factors. Through effective health education, oral cancer can be reasonably detected and diagnosed in early stages through a 5-minute thorough checkup. Thank you.